Let me start by saying thank you to the Planning Committee for the opportunity to share information about our center. I'm Marianne Smith, a graduate of the College of Nursing and the Aging Studies program, and an associate professor and director of the Barbara and Richard Csomay Center for Gerontological Excellence. I'm also the principal investigator for the Geriatric Workforce Enhancement Program, and I'll be talking about both programs today. The objective for the program is for participants to be able to describe research and training programs that are conducted by the center and its key partners. I'm sharing our websites here since much of the information that I'll talk about is described in greater details at these sites. An important starting point is to acknowledge our center's long history as a John A. Hartford Center of Geriatric Nursing and Excellence. Hartford funding was critical to our development of research, education, and practice initiatives, many of which continue today. I'd also like to acknowledge the amazing leadership of my colleagues, Dr. Marianne Moss, Kitty Buckwalter, Janet Spake, and Christy Williams, who each served as center director during the 15 years we were funded by the John A. Hartford Foundation. And I'd like to offer a special call out to my friend Kitty Buckwalter. Although Kitty officially retired from the College of Nursing nearly 10 years ago, she is still actively working to advance aging research and best practice care in her retirement and is a consultant for the Csomay Center. We were very fortunate to receive a large gift from Barbara and Richard Csomay that provides support for our operations and programs. In 2017, we officially changed our name to acknowledge their generous support. This is our homepage for the Csomay Center, which I'm going to use as a guide for today's presentation. Our website is constantly being updated with new information and resources, so please do visit us online. During our transition, we held strategic planning meetings to explore what we wanted to retain from our years as a Hartford Center and what opportunities existed to advance gerontological research, education, and practice as a Csomay Center. As you can see here, our mission is to advance innovative evidence-based practices and products that maximize optimal aging and adaptive function. Our vision is being a national and international leader in supporting health and adaptive aging in spite of multiple chronic conditions. In other words, we want to help all older adults achieve the highest quality of life and living possible, while understanding that late life is often accompanied by changes that demand adaptation. Let me introduce our center leadership team. Dr. Keeler has been actively involved with the center for many years and is the current co-director. Keeler is an expert on geriatric pain and leads initiatives to improve pain management and treatment for older adults. Dr. Leah Buck just joined the College of Nursing faculty this fall and is serving as the center co-director this year. Next fall, she'll become the director when I step down and start moving towards retirement. Dr. Jane Stickney is a geriatric nurse practitioner and faculty member who is leading our telehealth training and practice change project. Jane is also facilitating Jefferson County Health Center's work to be an age-friendly health system, which I'll say more about in a little bit. Linda Seidel is a program director for our Geriatric Workforce Enhancement Program, or GWEP funding, that supports the Iowa Geriatric Education Center, which she also directs. Linda led the IGEC through 15 years of continuous funding as a geriatric education center. and she's led the GWEP for 5 years. That funding will continue until 2024. Ryan Carnahan is a pharmacist that has specialized training in psychiatric medication and is an epidemiologist. Ryan leads several of our GWEP activities and is the data director for that program. Larry Newman is the director of the Adult and Gero Doctor of Nursing Practice program. Larry supports many of our training and practice change initiatives, including the telehealth project and our age-friendly program. You all know Mercedes at this point. She's also a GWEP and Csomay Center leader and a huge support to our work with community partners. Last but definitely not least is Riley Moss, our center administrator. Riley is the glue that holds us all together and makes everything we do better. She's an exceptionally gifted leader, editor, web designer, and creative thinker. These slides are Riley's creation, along with all of our web pages. As you might guess from the rundown of our center leaders, the GWEP and the IGEC are our center's main collaborator. Although the two are separate programs, we work to blend our activities and initiatives to achieve a synergistic effect. For example, our reach is greatly extended by our GWEP partners, which include Des Moines University, Eastern Kansas VA Medical Center, Intelligent Quality Improvement Organization, area agencies on aging throughout Iowa, community-based programs statewide, and services at the University of Iowa Healthcare. So thinking more about partners, our center has a variety of academic partners that support our mission and activities. A good example is the Young Gero Nurse Clinician program that supports undergraduate nursing students to engage in novel learning experiences with older people outside of their clinical experiences. Another is the telehealth training that we are conducting in collaboration with faculty in the undergraduate and Doctor of Nursing practice programs, and also with geriatric nurse practitioners in the college's faculty practice program. We're also partners with the Aging and Longevity program, and are very hopeful that we can move the University of Iowa to being an age-friendly university sometime in the very near future. As I mentioned earlier, our center is a member of the National Hartford Center of Gerontological Nursing Excellence that works to build the capacity and competency of nurses to provide high-quality care to older people. We fully support their Distinguished Educator program and are proud to report that one of our college's graduates, Kim Bergen-Jackson, was among the inaugural group of Distinguished Educators. Kim is the administrator of Oak Knoll, an active senior living community in Iowa City that's a center partner in research, practice, and education. I'm also delighted to report that Jane Stickney, a member of our center's leadership team, has also submitted her application for this prestigious designation. Moving on to our community partnerships, we're working to engage members of our region and state to inform our priorities for research, training, and practice, to evaluate innovative practices, to engage in research, and to advance adoption of evidence-based training. Before I move on, I'd like to clearly say that we have many wonderful community-based partners that I won't have time to mention today, but that have been and continue to be instrumental in research, training, and practice change initiatives. I'd like to mention a couple of our community-based initiatives that are a crosswalk between GWEP and center activities. Western Home Communities in Cedar Falls, Iowa, has been a partner in advancing innovative research and training for many years now. They currently are leading the dementia-friendly communities activity that adapts dementia-friendly America to their active senior living community. Western Home has 1,000 older adults living on their campus, of which 750 reside in independent housing, meaning they're bigger than some of the small towns in Iowa. Our goal is to launch dementia-friendly activities and training at Western Home, then expand it to the surrounding community, and then replicate the process in other active senior living communities. Another partner is the Quad Cities Senior Care Coalition that is working collaboratively to reduce unnecessary and unplanned transfers from nursing facilities to acute care settings. The main goal is to reduce emergency department visits by treating healthcare problems at the facility, which involves improved communication with residents, family members, providers, and also use of best practice nursing care. The COVID pandemic has stalled the initiative, but members have been meeting monthly for several years to share information, ideas, data, and best practices that benefit all residents in all facilities. Methwick Community in Cedar Rapids has been another great partner in research and training. They just made a big contribution to best practices by updating an IGEC dementia training program to assure it was current. We've also participated with the Johnson County Coalition since we were a Hartford Center and are excited to be expanding our work through nurse practitioners in our college's faculty practice group. As before, we have many more community partners, and each makes an important contribution to evaluating and using innovative approaches and informing center leaders about the next best steps. The Csomay Center continues to fund pilot research programs that we hope will provide a foundation for faculty and students to apply for larger external research awards. This is a long-standing activity that started with Hartford funding and continues today as an interdisciplinary nursing research initiative. I know this is a lot of information in a small space, but I wanted to share some of the topics that have been awarded funding over the past few years. As you can see, the topics are quite varied. In the area of practice, we have two initiatives related to pain in older adults. Both are led by our center co-director, Keela Herr, who is a nationally recognized expert in geriatric pain. We're very proud to support the Center of Excellence in Pain Education, which is one of 11 centers funded by the National Institute of Health. Our second pain initiative is geriatricpainorg that was originally developed by the 5 Hartford centers located in California, Iowa, Arkansas, Pennsylvania, and New York. The tools and resources were hosted by the International Nursing Honor Society, Sigma Theta Tau, and are now hosted at Iowa. We're also very grateful for additional funding from the Bowers Fund to adapt materials for use by family caregivers and older adults. As I mentioned earlier, we're advancing telehealth best practices through training and use in practice settings. 4 geriatric nurse practitioners are using telehealth in 10 or more senior living settings this year. We are also distributing iPads for residents to use to help reduce social isolation that has really escalated during the COVID pandemic. Two additional items that bridge the practice-education relationship are the Care of Older Adults book and our evidence-based practices. The digital book is edited by former Center Director Marianne and is available online. Evidence-based practice guidelines have been a mainstay of the Center for many years. While we have many EBPs available, we are going to be phasing this out due to lack of demand. At present, most are still available online. We gratefully acknowledge the support of the Joe Hoyt Freeman Education and Outreach Fund that supported the development of our Partnerships to Improve Care training program. This free online training series is guided by the evidence-based practice called Family Involvement in Dementia Care. The training is designed for long-term care staff and providers that care for persons living with dementia. Consistent with the family involvement in care model and guidelines, we use GWEP funding to develop a companion training program for family members. The two training series are both focused on the important roles that family play in dementia care. One from the perspective of helping family interact with providers and paid caregivers, family involvement in care, and the other from the perspective of providers and paid caregivers engaging family in care, our partnerships to improve care. We're also really excited to be developing training to provide the adoption of age-friendly health system practices. The age-friendly social movement is supported by the Institute for Healthcare Improvement, or IHI, and the Hartford Foundation. The 4M's framework starts with what matters most to older adults and addresses their medications, mobility, and mentation, dementia, delirium, and depression, that all impact being able to do what matters. The framework flips the question from what is the matter to what matters most to you. This is an important perspective for students to learn, providers to adopt, and older adults and family members to expect in their health care. We'll also be adding dementia-friendly community training materials and resources that are based on the work with Western home communities. As I said earlier, the goal is to develop a process that can be easily replicated. Our center also works to identify key resources that support our mission of advancing innovative, evidence-based practices and products that maximize optimal aging. Links to these programs are located at our website under Resources. Here are a couple more. Please know these are just examples. Last but not least, we've started a newsletter to highlight our work, our partners, and updates in the field of aging. We'd be delighted to add you to our mailing list. Please just use the contact information on the last slide. In summary, the Csomay Center leadership works to engage a broad group of community and academic partners to advance our mission of maximizing optimal function among older adults. We're excited by the number of social movements that strive to reduce ageism, increase respect for older adults, and support older people to remain as actively engaged as possible in all aspects of living. We're all about partnerships, so please do get in touch if you would like to consult, conspire, or collaborate to advance the adoption of best practice care and treatment for older adults. Thank you so much for your time and attention today.